Go live. All right. Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinto, CEO and founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm excited today to have on with me the one and only Dr. Uche Davidson, who is a spine surgeon. I'll let him introduce himself. And today we'll be talking about the topic, Doc, I'm told I have back surgery. How do I prep? Thank you so much for coming. Sorry about the hiccup earlier, but thank you for being here.
Absolutely. Thank you very much, Dr. Olabitan. Thank you for this opportunity. My name is Uche Davidson. I am a spine surgeon with Texas Back here in the DFW. I'm coming by way of Atlanta. I just finished my fellowship at Emory. Before that, I spent 5 years at the Cleveland Clinic doing orthopedic training. I'm really looking forward to interact with a live audience and hopefully answer some questions on how we get ready for spine surgery. Again,
Awesome.
thank you for the platform.
You are welcome. And thank you because I know you're busy. Thank you for coming. All right. So
Absolute pleasure.
first question I have for you, why do you do what you do? I always kind of like to ask that question to kind of give our viewers an idea of what piqued your interest and why. Like, why did you decide to
Yeah.
be an ortho surgeon?
I've always loved to help people from a very young age. Early on in school, I loved the biological sciences. I guess I was very inspired by my grandparent. My granddad was a pharmacist in the 1970s. He was the first in his region. Having such legacy and my fascination with anatomy and how the human body worked just naturally kind of steered me down the path of medicine.
Mm.
While in medicine, I love to use my hands. I love to build things. I love to kind of like break things down. So surgery just felt like a natural fit. Spine surgery, though, I found very fascinating. The complexity, the anatomy, the uniqueness of every single patient and every single pathology. Um, I truly was, really immersed in that field. That had a lot of evolution with technology and the ability to treat every patient in a very tailored manner. I just felt like, medicine, helping people, and just being able to use my hands, spine surgery just felt like a dream come true.
Awesome, awesome. Yes, it is pretty complex. So thank you for doing what you do. So my next question is this: what are three common reasons you see for spine surgery? Like, why do people come to you? What are three major reasons people come to you for spine surgery?
Yeah. There are various different spine problems and pathology. But if I can group them into three major buckets, I would say I see a lot of patients that have severe low back pain,
Okay.
with leg pain, numbness, tingling. I see a group of patients that come to me because they've been told they have a pinched nerve, whether
Okay.
in the neck, the thoracic spine, or the back. These patients are having severe pain, numbness, tingling, depending on where the compression is. I see a third bucket of patients that have spinal stenosis, which is a disease state where you have compression of the spinal cord. These patients are the ones that see their primary care doctors and their, specialists, and they are referred to me because they have some problem with balance. They have problems with using their hands.
Mm.
They can't tolerate, being able to walk down the aisle or go down to Walmart. They're having difficulty with their grip strength, and in very severe situations, they can have urinary problems or bowel incontinence. So these are kind of like the three major categories of patients that I see on a day-to-day basis.
All right. Now, the whole idea of surgery, back surgery, is scary for anyone. Um, you know, and so so for patients who, for instance, I'm referring to you or other specialists are referring to you and saying, hey, you need back surgery to relieve the pressure, I guess, of the bone on the nerves. Um, how do you alleviate that concern? And the reason I'm asking this question is because I know that there are new technology, there are newer methods with spine surgery, so it's not so. I guess it's not as invasive as it was before. So, what would you say are the common surgical methods that are available now, so people don't have to be so afraid of back surgery if necessary? Oh, can you hear me? Am I frozen? Am I frozen? Am I frozen? Uche, can you hear me? What happened? Okay, let me see. Give me 1 second. Let me see. Did I lose you? Did I lose you? Did I lose you? Are you still on? Give me 1 second. Looks like we're having some technical difficulties. Mm, can't tell if I'm frozen or if he's the one frozen. Give me 1 second.
Hello? I can hear you.
Yeah, can you hear me? Oh, can you hear me? Okay. We had a little glitch there. I think you were frozen. I was
No, I'm
frozen.
here.
All right. All right. So the question I was asking is, what are newer methods for doing back surgery to
Can
help
you hear
people
me?
feel a little more comfortable, especially those that, of course, those who need it, who need the surgery.
Yeah, absolutely. And I like the last sentence. I truly believe that surgery is a tool and always the last resort when you've exhausted conservative treatment. Um, Technology is advanced. I think there are numerous ways to approach the spine, and that's kind of what's my real fascination about spine surgery. For
Mm,
example, a lumbar fusion, for example, you can approach the spine anteriorly to the abdomen or the belly. You can approach the spine from the flank. You can approach the spine traditionally posterior in the lumbar spine. There's a lot of new advances in spine technology and imaging that is allowing us to do smaller and smaller incisions, but at the same time achieve the same goal. And by keeping the incision small, you limit the amount of surrounding tissue damage so patients can now recover faster and have less pain. Take, for example, my patients on average now leave the hospital the same day or the next day.
wow.
For patients that undergo fusion, they spend an additional day or two in the hospital. My patients are back driving between 1 to 2 weeks.
Nice.
Depending on the kind of job you do, my patients get back to light duty within 1 to 2 weeks. So there's a lot of imaging innovations that allowed us to be able to do the same surgery in a more precise and smaller scale. That I think naturally there is a concern and scare of spine surgery, but I think a lot of that is changing with the advent of technology.
Awesome. Awesome. I like the idea of being able to go back to some semblance of work even right after surgery or a day or so after surgery. So that's good. Um, how does one prepare for the surgery? So, I have a patient who's saying, I'm about to do surgery. Actually, I have a patient who's about to, and he's a little nervous. He's like, how do I prepare? How do I increase the chance of doing well after the surgery? What would you say, Doc?
I think it first starts with the interaction with your surgeon. You want to make sure you have a clear understanding of the diagnosis. What is my problem? What is going on with the spine? Is it compressed? Is it pinched? Is there instability? I think understanding the diagnosis and understand what is going on is the first place to start. Another important facet of preparing for surgery is fully understanding the alternatives. Have they been explained to you by your spine surgeon? Have you really exhausted every conservative measure? At Texas Back, we believe that every patient should exhaust every conservative treatment. This includes rest, activity modification,
Hmm.
anti-inflammatory medications, antispasmic medications, some neuromodulators like gabapentin or Lyrica that kind of helps you with the numbness and tingling. Have you done physical therapy? Have you done chiropractic care? Have you tried oral steroids or targeted steroids like epidural steroid injections? So there is a host of conservative treatment. And contrary to popular belief, 80% of patients that have spine problems will get better without surgery. So
Mm,
surgery is always the last resort. You also want to understand the basic complication risk profile. For example, have you discussed the risk of infection? Have you discussed the risk of nerve injury? What is your expected recovery timeline? A lot of patients have pain, numbness, tingling. When do you expect the pain to get better? When do you expect the numbness, the tingling? What are your goals and when can you get back to the things you love to do? So I think really spending time and understanding your diagnosis, understanding your recovery, and most importantly, understanding their alternatives. There are other modalities that we can use to get you back, and also understanding that you are in a very good position where 80% of patients like you would get better. So I think those are kind of like the tenets of what I would want a patient to ask your surgeon, and that's how you kind of get ready, making sure you've exhausted every alternative available for you.
I like that you emphasize that surgery is the last option, and you encourage patients to try other things as well. And obviously, surgery is an option. Then there are ways to minimize the risks for the surgery too. Now, specifically, doc, what would you say to the patient who is about to have surgery? Let's say maybe 2, 3 weeks from now. How can their risks of surgery be reduced? What can they do to improve their chances of recovering well after surgery?
Um, there are some rare complications with spine surgery that are not modifiable. The risk of, say, a very rare complication after surgery. So there are a few things that you can't change and are very rare, thankfully. However, there's a lot of modifiable factors that patients can actually do to improve their chances of having a successful surgery. For example, nutrition. Do you have adequate protein intake, calcium, vitamins? These are important health parameters that help improve your health status and help improve the chances of tissue recovery, bony fusion, and bony healing. Weight loss. If overweight, focusing on properly losing weight in a healthy manner. I always tell my patients, I don't want you to get on a crash diet and lose 20 pounds, but then be malnourished. But proper weight loss can actually improve your chances of avoiding an infection. There are numerous studies that have shown that increased weight and BMI have been linked to poor outcome, particularly infection. Um, Also, do you smoke? Nicotine, as we all know, is a very potent vascular constrictor that reduces the blood flow to tissues. If you smoke, studies have shown reducing your smoking or cutting down smoking for 6 weeks before surgery can immensely improve blood flow to the bone, to the tissues, and increase your chances of healing. Um, do you have any untreated cardiac disease or vascular disease? Surgery of any kind, not even, including spine surgery, places a lot of stress on your cardiac, respiratory, and vascular processes after surgery. So it's important to see your medical doctor to get a medical clearance. If you have any cardiac or vascular problems, it's important to get this optimized as best as possible to reduce the risk of a cardiac or vascular problem after surgery. Do you have diabetes? What are your blood sugars? I see a lot of patients that don't know what their A1C is. Now, having a better sugar or glucose control before surgery, during surgery, and after surgery can actually improve the chances that you avoid an infection and that the tissues heal and you avoid a non-union. I know I've mentioned non-union a bunch of times. Non-union is a state in spine surgery where after a fusion process, rather than fuse in the typical timeline between 3 to 4 months, you have patients that go on to not fuse, and that generates a whole host of problems. Another important modifiable factor is, are you immunocompromised? Do you have any diagnosis, for example, psoriatic arthritis, rheumatoid arthritis? Do you take any medications like biologics that reduce your immune system? Have you disclosed this to your spine surgeon or your medical team? This can place you at a higher risk of infection if not disclosed. A very common one that I guess, have come to learn recently is undocumented supplements. I have a lot of patients that take ginger, ginkgo, turmeric. This is just a few. All of these supplements have effects to your system. For example, we know turmeric is a known blood thinner. So it's important when you're describing or disclosing the medications you take, you include all the supplements because this can increase, for example, your risk of bleeding. This can change how your liver metabolizes the anesthesia. So it's important to disclose all this, medications. And again, contrary to popular belief, when you're getting ready for spine surgery, I want you to stay active. You need to stay active. Your rehabilitation and recovery is very dependent on how you get into the hospital. Patients that ambulate independently without a cane, without a walker, that walk into the hospital after spine surgery, Studies have shown that 95% of those patients are going to leave the hospital and go home. If you come into a hospital with a wheelchair, with a walker, studies have shown that you have a less likely chance of going home or needing to go to a skilled nursing facility. So, as tolerated, as depending on how much pain you're having and limitation, you want to stay active. You want to make sure your cardiovascular system is being, activated, and you are as physically able and ready for the surgery that you're about to have.
Wow, you dropped a lot of gems, and I wanted to pick at some of them. For those who are watching live and those who are watching in replay, please hashtag yourselves. I always forget to do that, but it's very, very important to get your medical health optimized before the surgery. You talked about smoking, what it does, why the big deal about smoking. Improves your lung function if you quit before, and actually helps blood flow, so the healing process is also optimized. Checking to make sure you don't have any immune things that would minimize the risk of you healing properly after the surgery. Making sure that diabetes, if at all, is controlled. Making sure if there's hypertension, that's managed. And that's why patients are sent to their primary care doctors, like myself, to do a medical clearance. Because sometimes I have a patient ask, like, what's the big deal? I'm fine. I just need the surgery. And I say, well, we got to make sure that you're able to handle the surgery as well. So a lot of gems you dropped. I'm hoping people are taking notes, because I am. But I have one more question. And this is where, we talked about already that surgery is the last, it should be the last resort. But I have patients who quality of life is pretty affected. And of course, these are medical suggestions. You should seek your own doctor, your own primary care doctor, and your own specialist to find out a plan that is unique for you. But I have patients who now they're it's very hard for them to stand for long periods of time. They no longer go grocery shopping because they're so afraid of back surgery. I want you to touch briefly. Are there any harms in waiting, like holding out as long, because of that fear? What would you say, Doc?
That's a very, very, very good question, because you get this question all the time. I get this question all the time. Um, Broadly speaking, I spine surgery or spine pathology can be divided into two major arms. There's an elective bucket, and there's an urgent and emergent bucket.
Okay.
Elective spine surgery are things like pain, numbness, tingling. A lot of this, disease states affect quality of life. With elective surgery, there is a reasonable time frame that you can wait. In
Okay.
most cases, staying active, getting back to work are often the driving factors for the timing. In this situation, it is okay to wait and exhaust every conservative treatment before surgery. However, I said the word reasonable. I always get into this bucket where I want you to be ready for spine surgery once you've exhausted every treatment available. But at the same time, I want you to be young enough and vital enough to tolerate the cardiac and vascular stresses of surgery. So there's a nice balance in waiting versus being healthy and young enough to undergo the procedure. Now, there's a whole different bucket for urgent and emergent cases. These are cases where the nerve or the cord is being injured or compressed. For example, in a motor vehicle accident, some instability, or patients that show up with frank, abrupt loss of motor function. In this situation, time is of the essence. Anytime the spinal cord or the nerve are compressed and you've lost
Oh,
strength, you've lost function, it becomes a race for time. The longer you wait, studies have shown that the chances of us don't recover that quickly. So it is important to restart off as an elective patient. If there's any weakness that changes it and what your diagnoses are, really can shape. There is a lot of alternatives, and you should explore those alternatives with the guidance. A lot of what we do with spine surgery, when it gets to the point where the hang out with family, cook, and do the things that you love to do, that is when spine surgery can be of use and be of benefit. But sometimes it's okay to wait.
Okay, and that's something that it can be made in discussion, of course, during the consultation with the spine surgeon. That's where you discuss how long can I wait, and of course discuss the risk versus the benefits. All right, awesome. Thank you so much for coming, Doc. This has been very, very useful. Even with the technical difficulties, we got a lot, and I'm hoping that people who could benefit from this get to watch it. Of course, those who are watching live replay, please share for a loved one who is considering back surgery or you think should consider back surgery because of how their life is being affected. Please share this with them. So the final question, Doc, is where can people find you? They're like, this doc is awesome. I like how he answers questions. I want to come consult with him since I'm in the Mansfield, Dallas area. Where can people find you, Doc?
Thank you, Dr. Labitan, again, and thank you for the opportunity. I am stationed at Fort Worth, Texas, in Mansfield. My office is at the Medical District in Fort Worth at 1650 West Rosedale Street. I'm at Suite 301. Our office phone number is 682-610-5670. My office in Mansfield is at 2925 East Broad Street, Suite 101 in Mansfield, Texas. And our number in Mansfield is 682-518-1215. Ask for Dr. Davidson. I will be happy to help you.
Awesome. And after this live, I'll put that information down so people can connect with you. We're literally not that far from each other down the street here in Broad Street. So that's awesome. Thank you again for coming. This has been useful. I took notes, and I look forward to having my patients being cared for you as necessary, as necessary, of course. Okay. All right. That being said, we are done. Thank you all for watching. Thank you for hanging in with us. And if you or anyone you know is looking for an awesome or a thorough family physician here in the Mansfield area, I am she. Have a good one, okay? It looks like Dr. Davidson is a little frozen. All right, everyone, have a good one. Thank you, Doc.